Good morning, you guys. I'm all alone for my Q&A again this morning. I'm so disappointed. Those of you guys that don't have Friday clinicals, shame on you. I'm going to share my screen here, and then we will walk through our objectives for pediatric hematology. All right, let's see here. All right, hopefully you can see what I do. If not, pull up your syllabus in front of you. So number 3, identify nursing interventions to manage patients with various types of anemia. That is going to be Vicky's and mine. Vicky has different types of anemia. I have just iron deficiency anemia for children. So just make sure you remember how we intervene. If you have a child that has anemia, what are you going to do? We're going to give them some iron. What's the best way to get iron to absorb? Give them some vitamin C with it. That kind of floats that boat right in there. Give them some high iron foods, limit some of their milk intake, and maybe give them a toddler formula or something like that. Dried fruits, meats like chicken, so giving them, chunking up some chicken on a salad or something like that can be kind of a good thing for them, or a little chicken breast and maybe some dried fruit or potato. All of those kinds of things will work. Then number 4, identify people at risk for hemophilia. So people that are at risk, that is a congenital problem. It's not acquired later in life. It is X-linked. And so men are more often affected. And people who have parents who are carriers or parents who have it are the ones that are at highest risk. But there are some people that don't have any risk factors and do end up having hemophilia. But just remember that it's X-linked and that it's that men are affected more than women. Number 5, identify clinical manifestations and medical management of a child with hemophilia. So what does that look like? So here's your clinical manifestations. What does that child look like? That child might have bleeding into their joint. They might have longer bleeding times with a heel stick, or longer bleeding times with a circumcision. They might have longer bleeding times when they've lost a tooth, or a menstrual cycle that bleeds a little heavier and a little longer. Just make sure you remember that they don't bleed faster, like it's not gushing, it's just longer. There isn't a cure for it, but there is management. And other clinical manifestations would be like in their labs. So knowing that a PTT is going to be prolonged because it checks for factors 8 and factor 9, as opposed to a PT, which is like 1, 2, 5, 7, and 10, I think are the ones that measures. And so they won't show up as being prolonged. Then you look at what you would do for them. So I have this kiddo who has hemophilia. What am I going to do about it? Well, I need to give them some factor replacement. And remember, factor is a protein. Proteins that are factor 8 and factor 9 are your type A and type B. And then you have von Willebrand disease, and that is von Willebrand factor. All of these factors are not platelets. So don't forget that. Don't confuse that. We do have platelet issues in this unit, but your hemophilia is a factor issue. So with medical management, you can give them prophylactic treatment. You can give them, then you can do that RICE acronym if they do have bleeding into their joint or they have an injury, or you can do the rest, ice, compression, and elevation. And elevating is really fast. You can slap a pillow right under their knee before you get an ice pack and before you do some of those other things, super quick. Other medical management, so replacing their factor, sometimes prophylactically, so before they have surgery. Then there's also, with the von Willebrand, they have the mucocutaneous bleeding, which can happen around mucous membranes. And so giving them the synthetic vasopressin, then they can that can help some of that bleeding that mucocutaneous bleeding, and it can be prophylactic. DDAVP is one of those synthetic medications that can be given with the vasopressin, so that it's called desmopressin, so it's a vasopressor that can help with that. Amicar is the antifibrinolytic, and that is something that can also help with the hemophilia. And then obviously they can treat afterwards too, but prophylactic before a surgery, before dental extractions, that kind of thing is the best. And just remember, type A is the worst, and A and B and 8 and 9. That's kind of an easy way to remember that. A comes before B and 8 comes before 9, and that's the factor replacement that they need. Number 6, identify methods used to prevent bleeding in a patient with hemophilia. We talked about a lot of bleeding prevention, and that was a great student presentation. And so make sure you look back to that handout. She's got it organized really well, and that little presentation. It is also pretty important that they wear a medical bracelet, and that they do their factor replacement and use a soft toothbrush, and all of those things that she touched on is a very inclusive list. Number 7, recognize and control bleeding when it occurs in the hemophiliac patient. So we want to control it. That's that RICE acronym again, same as like the medical management. We want to give them factor replacements, and we want to just be gentle with them. That's kind of the prevention of bleeding too. We don't want to move them up in bed too swiftly, where we can cause shearing on the sheets and cause other problems for them. Recognize and control bleeding, so make sure you're looking for petechiae and bruising and some of those kinds of things. Number 8, recognize the educational and emotional support needs of parents caring for a child with hemophilia. So think about the things you would teach them. So first we looked at clinical manifestations. What do they look like? And medical management. What are you going to do about it? And now we want to say, what are we going to teach them? Well, we want to teach them that they don't need to be kept in a bubble. They need to be protected, obviously. So suggesting that they swim instead of playing lacrosse, or that they play tennis instead of football, or something like that, that will help keep them healthy and strong and give them a way to do a sport or be included on a team. But then also, if they're riding a bike, then a helmet, obviously, for sure. But then maybe elbow pads or knee pads too, especially if they're a young child. Emotional support. So these parents, this is a lifelong problem. And so you need to make sure that you're getting them the resources they need, whether they need to be hooked up with a social worker. Also, the educational and emotional support, when you go into the education, talking about what happens when they have bleeding into their joint, giving them that RICE acronym, teaching them how to care for that, and then getting them follow up with a physical therapist. That really is important for the range of motion in that joint. But just remember, it comes after the bleeding is done and it has healed. Number 9, differentiate between various forms of leukemia. We have ALL and AML, the acute lymphocytic leukemia and acute myelogenous leukemia. And treatment is going to be the same. Well, I guess that's the next part. So you have your lymphocytes that are affected and your monocytes that are affected. So, or myeloid cells, sorry. So those are going to be your main differences in your leukemias. However, number 10, with the clinical manifestations and medical management of a child with leukemia, is going to be the same with those 2 forms of leukemia. There's nothing to remove, so surgery isn't indicated. We want to do chemotherapy. So first, your clinical manifestations. What is this child going to look like? Remember that dad that we saw in the video and the picture that was being painted? It goes kind of along with a slide that has just about every kind of problem that you can imagine, but then you start putting them together. And so you want to see if they have any abdominal distension. Do they have headaches, pallor? Do they seem anemic? Are they having fevers and trouble fighting off infections? And then your big hallmark sign is losing weight. So if you have and joint pain, so if you have a lot of these things, these things together, then you need to really consider getting them tested and getting some blood work done. Then you have your medical management. Your medical management is going to be chemotherapy and talking about how it kind of ramps up, how we initially do the induction, where we get them to remission, where they no longer have leukemic cells in the bone marrow. And then we ramp it up and we do intensification consolidation treatment, where they add different medications so that they have 3 or 4 that they're getting to decrease the risk of it mutating and having them be resistant to a certain medication. With bone marrow patients, then that's even more chemotherapy if they want to do a stem cell transplant or like an autologous transfusion. And what does that look like in medical management? What do we need to do for these kids? And how will we intervene? So think about your chemotherapy. Think about the path that needs to take. Then number 11, recognize principles used to prevent infections in patients with leukemia. So think about infection prevention. That was also another student presentation. So look at that. Look at the handout. It's very inclusive. She talks about avoiding crowds. She talks about, I think she even talks about the reverse precautions, or like the transmission, where we need to be cognizant of what we bring into them. So sometimes doing that reverse isolation where we put gowns, gloves, and masks on to protect them. Not digging in the dirt or sandboxes and that kind of thing without gloves on. Watching your fruits and vegetables not fresh unless they can be peeled. So I think we talked about them not being fresh. But if they can be peeled, then that is preferable. So like a banana, or if you can peel an orange, sometimes they'll take the skin off an apple. But anytime they can cook the vegetables. And when they go to a buffet or something, or a family party, not to eat fresh fruits and vegetables, to kind of stick with what's been cooked, but making sure that it hasn't been out for more than 2 hours. So think of some of those things that really can put them at risk for infections. Number 12, identify nursing measures used to provide a safe environment for patients with thrombocytopenia. That now we're talking platelets. Thrombocytes are your thrombocyto piece of that. Penia is less than or too small. So too little platelets. So that puts them at risk for bleeding. So then that takes you right back to that prevention of bleeding, even though it says with a patient with hemophilia. It can also go with a patient that has thrombocytopenia. So make sure that you know that that's the same in the prevention of bleeding, but that one is for lack of factor and one is for lack of thrombocytes. Number 13, identify nursing measures used to manage patient fatigue associated with leukemia and its treatments. That's how can we help them not be so tired. One of the things that feeds into that is them being in a lot of pain, them being lots of nausea and vomiting, not getting enough rest. So control their vomiting, control their pain. Make sure you're clustering your cares and staying out of there as often as possible. There's a slide there on right toward the end on fatigue that gives you some good indications of that. And then when you get down to some of your reading assignment here, and number 7, where it has several of the maternity and pediatric nursing in chapter 37, just gives you a little bit more in depth of those few key points. And the iron deficiency anemia also has family teaching tips with it. So I think that's it for our objectives. Let me go ahead and unshare my screen here. And nobody joined me. I'm so disappointed. I hope that helps you guys, and I hope that answers a few questions. This is a little bit easier unit than cardiac and respiratory that we've had, so hopefully gives you a little bit of a breather. And let me know if you have any questions. Those of you that have been emailed on Canvas, I need a response from you. So please check your inboxes in Canvas if you haven't in the last few days. All right, well, I hope you guys have a good weekend. Love you, bye.